Hello, welcome back to the show. I hope everybody had a good Thanksgiving. We're shooting this right afterwards. We were off for a week or two there, but welcome back. We're excited today to have, I think, a really amazing individual. He's been on the show in the past. He's backed by, in a sense, popular demand. He and I share a lot of, sort of people in common because we think very, very similarly. We're both, fascinated by natural health care, and we seem to have no way of wearing us out, right? I mean, they can say what they want, and I've been fighting for natural health care since I discovered the chiropractic, going after my headaches and nobody else on the planet to fix them. And it really got me excited, and I realized that I had a nice fight ahead of me, and it's gotten nothing but better. The current climate's pretty rough, but we really have, a real job ahead of us to tell the truth and get people to understand how the body works, the true nature of health, what it really means. And today's guest couldn't be better at that if he tried. The conversations I've had with him are always enlightening. And I want you to welcome back Michael Giamuso to the show. He is a certified holistic health practitioner. So he is extremely versed in multiple areas having to do with health from a holistic standpoint, natural standpoint. There isn't a topic I think I can stump him on. And he's here today. We're going to get into flu prevention and treatment. It's flu season, and it's every other season having to do with that kind of stuff. So let's get talking about, what is a flu? Why do we get these things? What's the higher purpose of these? Is it just plain misery? Is something good happening to our bodies? The old silly saying I hear once in a while that, wasn't what doesn't kill you makes you stronger, which is, silly. But there's partial truth to statements like that. When we challenge ourselves, we get stronger, but we can over challenge ourselves and get weaker. So let's welcome Michael to the show today. And Michael, how are you?
Good. How are you, Dr. Christopher?
Doing great. Doing
I
great.
appreciate you having me on the show today.
Oh, thanks for coming back. I loved our last session. I realized, I knew before that show even that you and I can go on forever. We should probably go to lunch, supper, and have a midnight snack and keep talking all day.
Definitely.
So let's get into this a little bit. So when I was a kid, I remember getting sick, and my mom trying to figure out, is it a virus? Is it a bacteria? Does he have a cold? Does he have a flu? Is it an allergy? Maybe he touched something funny in the yard, because I had a lot of allergies, and I also had flus and colds and the usual stuff that kids have. And differentiating them, I think today to this day for a lot of people is pretty confusing. And we sort of believe that flus are caused by viruses. Infections, in general, can be caused by viruses and bacteria. To keep it simple, but how do you look at these things? Give us a light, overview of what you think is going on with flus, viruses, colds,
Sure.
that whole world.
Yeah. So we have to remember that when do we get flus? When do we get a cold? When do we become sick? So it's a condition of the body, and it's developing that condition for a reason. So we have to kind of look at the underlying cause of why someone would be challenged with a cold or a flu. So oftentimes that season is with colder weather, right? So we might attend a football game and be out in the cold for a long period of time, and then we actually get a cold, and we call it a cold, and we get sick. So it's the conditions that take place within the body. So there's if you go far enough back to study germ theory, there's the difference between, I guess, two French scientists that always had the controversy of, is it a germ or is it the conditions of the body, the environment that takes place when someone's challenged with illness or dis-ease, right? So they went back and forth. I think it was DeCamp and Pasteur. And that's where we get the word pasteurization, right? So they sterilize milk, and the organisms are no longer in the milk. The premise there is that there are germs present that can get us sick. So the one individual thought it's these small microorganisms that cause the problem. And the other individual thought, well, it's the environment. So it's getting cold or a change in the conditions with the body. So if we take a step back and look at it that way, and the fact that we're challenged with sickness more in a winter season than the summer season, there's a lot of things we can extrapolate from that. So what do we have in the winter that causes the problem? What do we have in the summer that helps with that? So when we look at, oftentimes the mistake is we're focusing right now on sickness and what do we do for sickness? But the opposite of that is what are the people, what's the population that don't get sick? What are things that they do to stay healthy to prevent the sickness? So that's the mistake sometimes we make, is that we focus on the sickness. What about the things that keep us healthy? Because then we'll prevent the sickness.
Exactly. So I've said many times, why aren't we studying the winners? Why are we studying the losers? I mean, I think we want to study both, obviously. We want to study who gets sick. We also want to figure out, how is this person so resilient? This other individual who seems to never be sick, what is it? A lot of times you think, this person seems to do a lot of things wrong, maybe, and they still don't get sick. So what are they doing right?
Right.
What do they have that I don't have, or what another person doesn't have?
Right. So if we look at the difference between seasons, because that's really when it takes place, we're a little healthier in the summer than we are in the winter. In the summertime, we're outdoors with fresh air. In the wintertime, we're kind of cooped up at home and closed air, and that's recirculating. When we're outdoors, we're getting sunshine, so we get the vitamin D. That's critical with preventing sickness. So that vitamin D is actually a hormone. So we've talked a little bit about vitamin D in the past and the importance. So a lot of people run off and get their flu vaccines, but the virus mutates and you got to catch up with it. And that's a losing battle. What we really need to do is strengthen our immunity, but nobody talks about keeping a strong immune system and how to do that. So getting into summer, it's vitamin D with sunshine, it's getting fresh air and good oxygen. In the summertime, we're grounding ourselves. We talked a little bit about grounding and improving the body that way as far as strengthening immunity. Now let's go to the wintertime. In the wintertime, we have a situation where we have colder temperatures. And with colder temperatures, the air doesn't hold on to humidity, right? It condenses and we get it on the window panes and so forth. So we're breathing in air that's dry air. So a lot of people, this will go back to not the germ theory, but the conditions of the body. So the conditions of the body is one where if you're breathing in cold, dry air, what does that do to our lungs? It dries out our lungs. So once our lungs dry up, and in addition, we have the furnace running in the winter, so it's drying out the air further. You dry out the lungs and you don't have a good enough amount of humidity. The body's way to protect the lungs when they dry out is to create mucus. And so then we get congested. So we'll culture some of that stuff and say, oh, well, there you go, it's bronchitis or it's pneumonia, and we find organisms there. But the bottom line is we all have those organisms within our body. It's just kept in check. Just like cancer, everybody has cancer. It's just when it's not kept in check, then it grows out of control. So it's the same thing with our infections with the organisms of the body. We have good organisms, we have bad organisms. And once the conditions change, it creates an environment where the bad organisms can flourish and cause a problem within the body. So since I've made the recommendation to my clients to humidify their homes during the winter season, I can't tell you how much that reduced my client load in regards to flus and sickness and having to deal with that. So just the simple fact of humidifying a home somewhere between 40 to 50% during the wintertime has literally prevented countless of flus and sickness. Just humidifying the air. It's just essentially... How
do you do that? What's the best way of someone humidifying their house? Is there a simple way of doing that?
Yeah, it's essentially imitating the summer conditions in the winter, right? Okay. So a way to do that is a humidifier. Just buying a humidifier, and it should be a warm mist humidifier for many reasons. We can get into that if you want. But that will put steam into the home and rehumidify the home you can put a humidifier on the furnace, but you really need one at the level of your home and your living quarters. You need a humidifier running. So that does, people get rid of nosebleeds, headaches during the wintertime just with humidifying. So of course there's dry skin and all those other issues due to wintertime, and that can prevent that as well. So I highly recommend that people try to imitate the summer conditions in winter. And a big key to that is humidifying. Now we can talk about boosting the immune system and getting into supplements in regards to keeping the immune system strong. That can prevent colds and flus. So we were in a time now where the public has first heard of coronavirus with this COVID challenge that we've had. But coronaviruses actually make up colds and flus, and a lot of people didn't know that. That was a technical term for getting a cold or a flu. These are primarily coronaviruses.
Right.
So it's addressing essentially viruses. And there are antivirals that are both medications and natural that can address it. So once you haven't prevented it and you're challenged with it, then the goal is intervention as far as getting the conditions of the body back to homeostasis, to balance, right?
Right. Well, one thing I wanted to point out before you get into that too much even is that whole concept of creating, summer and the winter. I think that's a great way of saying it. And one of the ways I think we will add to that, and I think you certainly know this, I'm just saying to put it in the same category for people listening to this, is full spectrum lighting, right? So you're getting a nice bright light that can mimic the sun to some degree, stimulating your skin. People may know that if they've had seasonal affective disorder, they get like a SAD light, SAD, seasonal affective disorder. They get a light that puts out such a bright full spectrum that it stimulates probably a lot of hormonal changes in the body that are positive, because if the sun's a universal source of energy to the earth, I think we should probably get as much as close to that as we can, even if it's in a partial artificial way, which is a light bulb. But it's certainly better than these horrifying bulbs that are out there now. So getting the lighting right, and for me, one of the things I try to bring up, and I'm still mystified why this isn't being promoted, is heat exchangers. Exchanging the air in the house with outside air and warming it in the wintertime. So a series of pipes going one way, another series of pipes going the other way, and they thermally catch each other. So the warm air going out heats some of the cold air coming in, but it's fresh air. But you're trading some of the heat off. So you're not like when you open a window, you're losing a lot of heat, obviously.
Right.
With an air exchanger, you're trading some of that heat off.
Right. And you mentioned light, and light's super important. So when you're sick, we talk about hypothermia. You want to increase the heat of the body. It's like inducing an artificial fever. So there are saunas, which are excellent. Some of the best ones are infrared saunas. There's the light that you're talking about, right? So infrared saunas help to stimulate the mitochondria, your energy in your body. If you notice when you get sick, you're low on energy. So if you have high energy, you really don't get sick. You want to keep your resilience, your resistance, your immunity, your energy. And so when you talked about the sun's just a huge battery that charges the earth and provides us with energy. And it's in our foods when we eat it. It's in sunlight when we bathe in it. So it is energizing us, and we lose that in the wintertime. We're staying indoors again. And you're right. I mean, we have to bring the conditions of summer back in. So how do we get fresh air? How do we get humidity? How do we get grounded? How do we get that sunlight? So a lot of people do get depressed, like you mentioned, as the seasonal affective disorder. So there's a lot of people get depressed in the winter. And one of the key things is turning on your lights at home. A lot of people, believe it or not, will live in the dark. It gets very cloudy during this time of the season, and people get depressed, and it's gloomy during that time. Turn on your lights at home. It's a simple concept that will go into your eyes and activate your hormones, your pineal gland. It does a lot of things to kind of revitalize the body, and light is energy. So when you're
Are there any kind of lights that you find better than others? Like, how do you feel about LED, fluorescent, full spectrum, incandescent?
Yeah.
Give us some.
Incandescent is full spectrum lighting. You do want full spectrum lighting, and they have different measurements for it. So they have warm lighting, white lighting. They have. So you want to stay away from the energy saving bulbs, the curly Q looking bulbs. There's thankfully less of those around now. LED bulbs are acceptable, but they're not incandescent. They're not full spectrum, but they're acceptable. It's better than no light, right? Excuse me. And some of the most beneficial light is infrared light. And that's what the sun gives off, is a spectrum of infrared light. So that's what we want to do, is we want to try to get all the colors of the rainbow, of the spectrum, because each color, there's a science to this, each color will provide the body with a different function. So the back of our retina, for example, is red and purple, and those colors will help support the retina and eyesight. So infrared is actually very good for eyesight. So all the colors play a role in helping to stimulate. So life is pretty much vibration. So all matter is vibrating. And if you understand energy medicine, I think that's one of the top things to understand in kind of like our field in medicine is
Absolutely.
if you understand energy medicine, grounding, infrared energy, how the body works from a frequency, from an energy standpoint, you could do a lot more than you can chemically.
Do you have a good book you could recommend, Mike, for energy medicine? Because there's a couple. I read one years ago called Vibrational Medicine. I think the author was Gerber a while back. Is there anything that you pops in your head that somebody could read that would be really great
off
book?
the top of my head, I don't recall the titles off the top of my head, but there's excellent, like 3-4 really good books on this topic. And I had it on my website, but unfortunately that, it got hacked and we don't have that page up anymore, but maybe I could provide a list of that. But there's some excellent books out there. I'm trying to remember the authors and the titles.
Look it up by topic maybe, but and then we can maybe put it in the after this video, put it in the links.
Yeah, the electric body would be one of them. That's one I can recall. So the electric body, I forgot the author.
The body electric. The body electric.
The body electric. That's it. Yeah.
Yeah, that's been around a while. That's a great one.
Yeah, there's like a 3-4 real good books out there that people can read that are really good on that.
Okay.
And then you can get into all kinds of therapies that are energy type therapies, but essentially it's increasing the energy of the body to be able to have that resistance and not have a cold or a flu, really.
Right. So a lot of people, I think, get this idea that, humans are hibernators. So they turn the lights off, they mope around, they just expect to be miserable in the winter. And of course, then they get sick and they say that's all part of it. There's sort of this bizarre acceptance I've seen with some patients. Well, it's winter in Buffalo, so here we go. Well, it's not just winter in Buffalo. It's winter, for a good half of the earth. And it's also, very cloudy where we live. And I lived in Minneapolis for a while. And it's a little sunnier in the winter, but it's so cold, you tend not to be outside very often. Right. I used to force myself to go out there, but I mean, literally, it would be minus 20 out. One day it was minus 40 with a minus 70 wind chill. People think it's cold in Buffalo. Try walking around in Minnesota someday.
Yeah,
beautiful, wonderful people out there. All my nieces and nephews and in-laws live out there. They're hardy, wonderful, amazing people. But boy, telling you the wintertime is something else. But, so I am like you. I try to tell people, no, we're not bears. We don't just go into hollowed out trees. We may expect a little less energy in the winter, but, I wouldn't say tackle your biggest projects in the winter. But come on, let's not get into being, sort of lethargic, right? I mean, you believe that we should stay energetic all year round, don't you?
Yeah, absolutely. So part of the humidifying we talked about. So when you humidify, what you're doing is you're heating up a water source and it turns into steam going into the air. That's energy. You breathe that in, you're energizing your body just by breathing in those molecules that have a higher state of energy. So there's taking vitamin D, humidifying the home, it's doing numerous things. And people will underestimate it, but that's what will keep them healthy. And the important thing is you're just not avoiding sickness, but you're actually feeling, a lot of people go, oh God, here comes winter. Oh my God, I can't go through another winter, especially when you get older, right? Because we lose our energy. When you do this stuff, you humidify, you take vitamin D and you do some of this stuff, it literally change the pH in your body. You'll feel more oxygenated and you'll literally feel like winter is easier to go through. Again, you're mimicking the conditions in the summer. So you actually enjoy your winter. You don't have to worry about feeling like you're dragging through winter because it will suck the energy out of you, quite frankly. So when you look outside, what do we see? We see in the summer, birds, colors, growth, right? In the winter, we can almost define that as death, right? All the birds disappeared. There's no color, there's no energy. It's lifeless. And that's how we feel.
I agree. When you talked earlier about color and how important it was for the retina and that different colors stimulate different parts of the eye, I thought of a time one time I was in my office working, and I looked out the window, and everything, literally everything, was silver, black, and gray. Everything I can see except for this one sign. It was a real estate sign, and it was bright red. And I thought, oh my God, everything, because there was salt on the road. So the road was whitish, right? It wasn't even black, so it was a whitish
Yeah.
gray. The sky was gray, the snow was dirty, and all the trees lost their leaves. There weren't any like evergreen trees to look at. And I was like, and the building I was looking at was white. And I thought, wow, wow. I remember being in the Rocky Mountains looking at a tree blowing in the wind, and these leaves were moving all over. And it was every imaginable shade of green that you could come up with, all like flickering in my eyes. And I thought that's got to be healthy to challenge my eyes with this multitude of shades of green
Yep.
flickering going on. I just kind of stared at it, and kind of it was like hypnotic. It was beautiful.
Sure.
And
Yeah, green
I
green
compare
is
that to silver, you know.
yeah, and green is very energetic. That frequency really raises our energy, and obviously it's more abundant in the summer. But really, you can define it as an absence of color and energy in the wintertime. You know, everything is really stark, white and gray. And I happen to live in Buffalo, New York, as you do. So we understand that season. It's just a long season for us, probably a good half of our year.
Yeah.
So, you know, vacationing is an eye opener when all of a sudden you just within a few hours time, you drop in and you have all this color and life again. So we really need to like live in harmony with nature and be able to kind of at least mimic some of that in the wintertime. Because otherwise it really is about it's so that when we started the conversation, it was the germ theory versus the environment. So
Right.
now we know. So apparently the camp, if I'm pronouncing that properly, it's a French name. He said that it was the environment, and then Pasteur said that it was a germ theory. And apparently, uh, once Pasteur passed away on his deathbed, he made the admission that it had more to do with the environment than it had to do with germs.
Mm-hmm.
So that is a tale that's told in the medical field of the difference between, is it a germ that causes the disease or is it the environment? Now we can say pretty definitively that it's both. One affects the other, and
Yeah.
that if you change the conditions, you can change conditions to the point where this is called, by the way, a term that's called pleomorphism. So pleomorphism is when you can take, let's say, a red blood cell underneath the microscope, you change the acidity or alkalinity, the pH of it, and you watch it turn from a red blood cell into a bacteria or into a virus, or
Mm-hmm.
you change it back again and it goes right back into a red blood cell again.
Mm-hmm.
There's a change that takes place. And so
Wow.
it's really based on the conditions on whether you end up with a beneficial, let's say, probiotic or a pathogenic type organism that can affect your
Mm-hmm.
health. So there
Yeah.
is that goes on that a lot of doctors don't acknowledge. It's not part of their curriculum and their training, but that's the way nature works. So that's why it's so important to talk about conditions in the environment, because then you'll start dealing with infections and pathogens. And the way out of that is not just killing the pathogen. If the conditions are the same and you haven't changed the conditions, you're going to be continuously taking antibiotics. You're going to be continuously challenged with your ill health because nothing
Absolutely.
has been done as the underlying cause of that problem, right?
I hope everyone really believes what you just said there, because I can 100% back that up. I've learned that in my youth, in a sense, the hard way, because, I didn't change my own personal environment. I just took antibiotics and pain medication and allergy medication and all the stuff that my very, loving mother, that's all she knew. And she dragged me from one doctor to the other. And it was, it never really solved until I really got on board with changing the environment in my body through, my thoughts, my physical activity, and the food I was ingesting, and being very
Definitely.
specific, doing elimination diets, looking at blood type, looking at all that information to get what works for me, personalized programs, just what you do with your clients and what I do with mine. We're not all the same. We're similar, but we're not all the same. And
Right.
what one person can tolerate, another person is crippled by, and what one person gets energy from, another person may, be devastated by.
That's
You
true.
think
Yeah.
you think about dairy products and grains and gluten and some of these things that Some people, they just, I don't know how they break it down, but they eat it and they just seem to be fine. And I get that in my body, and all kinds of, debilitating things start to occur. And, mine weren't devastating, but they were, shaving off, a good portion of my vibrance. And it's such an amazing thing to live without that stuff and feel, more alive than most people walking around,
Absolutely. So in general, it's true that if you have like flour products, grains, those types of carbohydrates, that you're acidifying the body, which is really depleting your oxygen levels, your alkalinity. So keeping yourself alkaline is keeping a strong, resistant body and a good immune system. So the consumption of kind of like a Paleolithic diet or like a ketogenic diet, leaning in that direction with meat and vegetables, would be preferred. And so you're right, we're all individually different. And the reason we found that the reason why people don't tolerate, let's say, dairy products or gluten and those types of carbs is because they're missing the probiotic that helps to digest them. So they'll go in as a foreign antigen or they'll go in as a poison into the bloodstream and cause the problems in the allergen. But if you have the probiotic pertaining to that particular item you're allergic to, whether it's a dairy, casein, or lactose, or if you have the probiotic that digests it, it no longer becomes an allergen. And probiotics are extremely important when we're talking about keeping a strong immune system. I highly recommend kefir to all my, as you know, to all my clients.
You're telling me that,
but even a good full spectrum probiotic, if at the moment they can't tolerate the dairy. But just to give you a simple example of how you can overcome, let's say, gluten, is you take some flour product and you put it in a pan, you pour some water on it, you let it sit overnight, and it creates organisms. And then you would eat that in small amounts the next day, and you would keep that up until your body builds up that probiotic, and now you no longer have a sensitivity to gluten. We've done that with some clients, and it's helped them not have a gluten sensitivity. In fact, I was a celiac. I had celiac disease at one point, and I have absolutely no allergens to gluten anymore. I can eat whatever I want.
I didn't know that. Fantastic. I didn't know you fixed that in your body.
I did.
So what you're saying there is you're taking gluten, letting it sit out long enough for the bacteria that would naturally break it down to proliferate. Then you're ingesting the glutinous bacteria and the gluten to get them inside your body so they set up camp. And then when you're eating gluten in the future, they're there to help you break it down.
Exactly. So you're really culturing it. You're fermenting it. You're culturing it. And then you're taking small amounts of it so your body gets used to it. And you literally build up your immune system. So now you can digest the product without it being partially digested, entering into your bloodstream, being a foreign antigen, and getting the reactions you would get with your allergy.
Wow. So I mean, that's pretty wild. I've never heard that one. I know the theory, but I've never heard it. I've never seen anybody just throw a pan of glutinous material, let it ferment, take it the next day.
And there are specific probiotics, certain organisms that are excellent for things like colon disorders, like Crohn's disease, ulcerative colitis. In fact, I kind of specialize in stuff like that, autoimmunity and colon disorders. So I've gotten people out of things like Crohn's disease and ulcerative colitis that they had to do blood transfusions. It was so bad that they were bleeding, and just doctors that said there's no, don't fool around with a nutritional guy. You're going to be on drugs for life. You just have this situation, and they get out of it and they're okay. You just have to have an understanding of why they're challenged the way they're challenged. That's all.
Years ago, I was invited to speak to the Holistic Medical Doctors Association at the University of Buffalo. And I was a chiropractor probably 10 years at the time. And I remember walking down this sidewalk, and I looked up at the building, and etched in stone it said, School of Medicine. And it, obviously had been there for God knows how long, the mainstream campus out here. And I thought, this is going to be interesting. I think there's a dawn of a new time here. They're inviting a chiropractor knowingly in to talk about natural health care. And I had an audience of probably more natural leaning medical students. And it was a challenging yet very fascinating talk. And one of the main things that reminded me of this talk as you're speaking is that I tried to encourage them to look beyond the paradigm and stop looking down just that one pipe. I mean, be good at that. Be a good medical doctor. Know your drugs. Know your doctor. Do the medical doctor thing, but don't be so stuck in that you think that's all there is. Is that all there is? And that's the problem I have with so many things. I don't think chiropractic is all there is for back pain. I know it's amazing for back pain and headaches and all the stuff, but I don't think it's all there is, because I've had patients I couldn't get better, and I found something else just outside the scope of chiropractic or a different practitioner, and they got better because that was the problem. And even though 80-90% of the time they're going to come in and I'm going to be able to fix them, or the chiropractic is going to be able to do their problem with specific conditions, there's times where it's not. And if I'm not open to that, that patient suffers. And the goal being, as a doctor, we can say, well, our job is to be a teacher, to profess our knowledge and to take care of patients and get people well. But it's also to not have an ego so massive that you believe that your way, even though your way's amazing and you got worshipers telling you how great you are, that's great. But believe that you can't know everything. And it's practitioners like you. I mean, how amazing would it be to have you sit down and talk to a bunch of medical doctors that are, in a sense, telling people stuff like, don't bother changing your diet. It's not going to make any difference. You're to be on drugs the rest of your life. I don't understand the value of that statement. Why not say something more along the lines of, your condition necessitates drugs at this point. I encourage you to do the most natural and healthy things you can do to build your body back to strength. And then someday, possibly, we'll be able to back down on these drugs and you can live without them. Is that some crazy? Am I insane? Am I coming up with strange ideas here? I mean,
I wholeheartedly agree with you. And I think so. Chiropractic is dealing with the nervous system, as you know. And so that's a big part of immunity, and that's a big part of the way our blood works and creates various components of the blood. So if there's any impairment, blockage that goes on, it can raise your blood pressure. It can give you tinnitus. You know it. I mean, it can do multiple things, and it's a critical part of staying healthy. But so is everything else, like you mentioned. So there's complements. So you can't say, is it chiropractic or is it nutrition? It's both. It's a lot of people make that mistake that they have this dichotomy, or it's black and white, or yes or no. And essentially it's not. It's like you need to identify all the problems, or what I call the insults, get those out of the way so the body can start working properly. And then put in place things like we talked about with the seasons. What are we missing and what do we need? Those are deficiencies. And that's why we call them supplements, is to put in place what's missing. So it's absolutely correct. So when we talk about the medical profession, they don't get a lot of training with any of all what we just mentioned. And I actually gave quite a few lectures at the University of Buffalo. They had me as part of the program too. Yeah.
Oh, fantastic.
So it's not mainstream there with the medicine department, but they had their night courses where they had people come in at night for the alternative medicine, right? And so
I like how it's at night, like it's under the cover of darkness.
Yeah, right. But what was fascinating was I did get lots of medical professionals at the lectures, and a lot of interest at the lectures, and they kept running these sessions with me and providing them with lots of education, awareness, and understanding with how nutrition and health, from the natural standpoint, plays a huge role in it. And all they have in their toolbox is their drugs. It's if you have this, you get this color pill or A or B, and there's no looking for underlying causes. It's all about management and it's crisis care, right? So it's not redesigning anything or retraining people with how to eat or any of that. It's all about, I got some medicines in this bag. That's my toolbox. That's what I learned. I got my training from the pharmaceutical company. That's what we provide you. So once I did some of these lectures at the University of Buffalo, people never got this kind of information before. They ate it up. They wanted to know more. I mean, there's some of the things we talked about that are so simple that, well, how come my doctor, you hear that all the time. How come my doctor hasn't told me about this? How come they don't tell us this?
I hear it at least once a week from somebody, like, why didn't my medical doctor tell me that? One of the things at the lecture that I gave is there was one student, and she said to me, well, how would I, and how and why would I send you a patient? And she just was looking up in the air, like mystified as to how is it going to happen? And how would she know who to send? And, all this. And I said something as simple as, come and follow me around for a day, and you'll get a sense of what I treat, what I say. And then when you're in front of a patient and what you're doing isn't as effective as you wished it was, or it's reached a point where it's just not working at all, um, send them to me, and you'll know who to send to me. I know who to send to you. Why don't you know who to send to me?
Right.
Right? I've been taught to refer for the conditions that are outside my legal scope of practice. Why? And she goes, yeah, I don't know why I'm not taught that is. And then she was like, started out a little bit like cynical with me, and then by the time we're done talking, she's like, yeah, she was irritated with her education. And I said, there's a lot to learn. They can only teach you so much. You guys have an incredible course load. It's okay if you come out with a cookbook, but then become expansile. Learn the different disciplines, because you're in taking care of people. You're not in just distribution of medication and references to surgery. You're inside someone's mind and their heart and their nervous system, and you're interacting with people. It's personal. A good relationship between a patient and a doctor, in my opinion, is a personal relationship. People tell me, well, you get too personal with your patients, or you I don't care. It's that's not the job. Isn't to stay distant. The job is to get inside people's thinking
Sure.
and be able to really get to know what makes this person tick, and be able to say and do the right things. I always will diagnose someone better if I know them better,
Oh,
right? If I don't
absolutely.
know who they are, you have a distance.
I tell all my clients, when you fill out my forms, the goal is for me to understand you. The better I understand you and the better I know what's going on, the better I can help you, period. And in regards to people who question, like, what modality should we use? What different therapists should we go to?
Mhm.
I take a step back and I say, listen, we have a situation where when you go into a medical training, I don't care if it's a university and you're getting your internships and so forth, you're put within a box. You're in a box. And anything outside that box, I wasn't taught that. So that's misinformation. That's alternative. That is like take a glass of water. It'll help you out. It's just watered down. And so I tell them that if you look at any progress that we've made in society and space, I don't care where it is, it's people who have thought outside the box. If you
Absolutely.
stay within that box, you're not going to make any discoveries. You're not going to have any great insights. You're not going to get any understanding. It's going outside that box to find out what really needs to be done and how to address it properly. Because unfortunately, everything within that box are moneyed interests and and I agree with you. God bless you. And I agree with you that if we think it stops with us, it's a problem. So when I immediately recognize that someone needs an acupuncturist, a chiropractor, or some kind of PEMF therapy, anything, I'll send them right off that you need to complement with this. Just don't do what I'm doing. It's important, but you need to complement with A, B, and C, and we'll get you there quicker. And then I worry less. See that when you practice the right way, you make an investment in your client. You're worried and you're concerned about your client. Unfortunately, most doctors aren't. It's just next. It's just take this drug, see how it does. If it doesn't work, we'll try a different drug. That's not
Right.
making a commitment or an investment with your client. You're not there for your client and concerned and follow up with your client. And I
Yeah.
think that is missing today. In the past, doctors used to visit people at their home. They used to
Mhm.
open the refrigerator. What are you eating? What are you doing? They look at their environment. Are you a mess? Do you have low lighting? Open up a window. I mean, doctors don't have a clue right now what the conditions that people are under, their stress levels, their family situation,
Right.
nothing.
And I
And I,
think that's
I'm
what's
wholeheartedly agree with you that you need to understand your client and your patients.
I think that's what's so important about the type of work that we do, that people have us to do that maybe. And the emergency medicine, or the more symptom based stuff, they have the medical doctors for. It'd be nice if everybody could get along, and obviously we are getting along a lot better than ever. You're seeing, I think the advancements of science have been able to show us how vibration matters, and how diet, nutrition, and all that matters. But getting back to this for a second, so in summary, so far you've said we want to humidify the house. We want some full spectrum lighting because we're going to mimic the summer and the winter. An alkaline diet,
Alkaline diet.
which anybody can look up the alkaline foods. You can get a list off the internet in a second. I tell my patients, print out the list of alkaline foods, stick it on your fridge, bring it with you shopping, and do your best to eat all the alkaline foods more than the acidic foods. And then you're talking about probiotics, and you love kefir. I understand why. Um, Beyond those, there's loads of vitamins, minerals, herbals, and I looked up a couple to try to get some ideas here. And one of the things I looked at was I wanted to see if T cells could be stimulated. In what ways are they stimulated? And I found that there were certain nutrients that did that. Exercise, by the way, does that. We all know it. We don't have to go over that probably. Everybody knows you better exercise. You're not going to be healthy.
Sure.
Because it stimulates your lymph system, and your lymph system is your tonsils and your thymus and all this stuff that gets to that immune system. We won't go on about that today. That's a whole nother talk.
Sure.
But I found that T cells are stimulated. Green tea actually stimulates T cell numbers. It actually improves your T cell counts.
Yep.
And the T cell is the other way the immune system gets after the different pathogens that might be in your body, viruses, bacteria, besides just simply the antigen antibody model that we know about, the antibodies everyone's talking about today.
Sure.
The T cell immunity is a whole nother world within that antibody antigen world. And we
Sure.
certainly want to enhance that as well. So
Yep.
green tea being an alkalizer as well, and being a stimulus to the T cells, I thought was, very interesting. And as well as garlic is a T cell booster. So some of the basic foods, I grew up, as you probably did, were surrounded with garlic, being Italian. And, my father would chew raw garlic if he didn't feel good, so he'd be in the
Yes.
kitchen making a face and just chewing through raw garlic.
I actually
And then he
love
would
garlic.
Yeah, then he could simmer the garlic, and then we'd be eating garlicky food for a while because he wasn't feeling good. And if we didn't feel good, we had the option to chew garlic along with him, which, is challenging for everyone in the house.
Yeah.
But, he's a pretty healthy man for the other choices he made in his health. He lived a long life for all the insults. He had his, his remedies and then his detriments. But, what are some of the nutrients that you see? We talked about vitamin D as well, having to do with lighting and being a hormone. What are some other things that you see that are nice immune system boosters that people can just kind of rally around?
Yeah. So a lot of people don't know what actually helps to boost specialized cells. So the T cells are your innate immune system. And T cells are really important when it comes to, most people are familiar with antibodies. Antibodies is just the cleanup crew. They come around to clean up the debris after the macrophages and other components of the immune system go in to actually kill the pathogen or the infection and dissolve them, and uses things like peroxide and other substances to actually attack the organism. But the T cells is a specialized immunity, and it's something that memorizes what we all come in contact with over our lifetimes. So the way to increase T cells, a lot of people don't know the nutrients involved, but the reason why garlic works is because it's high in selenium. Mm-hmm. Selenium is an excellent way. Approximately 200 micrograms daily of selenium can actually help to increase your T cell count pretty significantly. Another nutrient that helps to do the same is zinc. We've all heard about zinc recently because of the COVID situation. So zinc is increases your T cell counts. Selenium increases your T cell counts. But what it also does, zinc helps from replication so that you don't get an increase in the population of those organisms. So it stops the reproduction of. And also selenium helps to increase your glutathione reserves. So glutathione is a big part of your immune system. It's the master antioxidant of the body. So when you increase selenium, you're increasing glutathione. And again, that's a big part of how all your immune cells get their energy, their food, and stay strong, is through the use of glutathione. So people will make the mistake of taking glutathione supplements. Glutathione is not well tolerated and it's not well absorbed. So that's the wrong way to do it. You need the precursors of glutathione. So if you want to increase T cells or any other of the specialized cells of your immune cells, you would take things like N-acetylcysteine. So that's an amino acid. That's a precursor. It needs NAC to create glutathione. Another one would be glutamine. Glutamine, bodybuilders take glutamine, increases your muscle mass. We talked about increasing your energy levels. There's no better way to increase your energy levels with glutamine. So it's L-glutamine. So L-glutamine will increase glutathione, NAC will increase glutathione, and so will selenium. So selenium can't be taken alone. So there's selenomethane, which is an amino acid that's binding to the selenium mineral. And that would be the way to do it. Again, approximately 200 micrograms. So yes, T cell immunity is a big part of our innate immunity and is like the overall, the largest military, if you will, of our immune soldiers that go on and get activated
Yeah, let's
And
make sure people understand,
pardon me.
innate immunity. Innate implies that it's there for us, and it's not something we develop later, like an antibody, right? The innate immune system is our skin, the salinity, the pH of our body, dendritic cells, and of course the T cells. And it's, in other words, it's like you're saying, the antibodies come later to clean up the debris. They're attacking
As
things,
the
but
byproduct, this would be the base of how it all functions, would be part of it would be the T cells.
right. And I always tell, because a lot of patients say, why are kids sick so much? And I'm like, well, they don't have the experience in their immune system oftentimes. So they don't have all those antibodies stored in their T cells and their B cells stored away from experience. But all they have is that innate, and that's obviously making a big difference. That's why they're as healthy as they are,
Right.
but
It's
they
the
don't have the full
memory.
complement yet.
Yeah, so
What's that one?
the memory, if you will, of the immune
Yeah.
system. Right.
Right, exactly. So to really get it going, I think you're in that healthy zone in your teens and 20s, in that mid zone where you have both going for you, as long as you're doing healthy things, in a general sense.
And then also the other thing also is that a lot of us have organisms that are taxing our immune system. So anytime the immune system is working hard, you're suppressing your immune components, including the T cells. So if you alleviate any viral loads, any bacterial loads, what's not talked a lot about is parasites. There's parasites in our food supply, in the meat, in the water, and we don't really talk about it in this country, but essentially that taxes our immunity. And there's also something, I think CMV, it's a long word to pronounce, but we all carry it. 90% of the population carries this virus in our bodies. And if we get rid of that and we eliminate that, so you could do that with an immune program that has an antimicrobial program that kills off these offending organisms that are taxing you, taking your energy. Your immune gets suppressed with these organisms present. Once you kill them off, your immunity strengthens. So you have to look at that component as well. So you want to provide the food, the substance, the source to keep your immune system strong, but you also want to get rid of, again, the insults, those organisms that may be present. You want to kill those off so they don't tax your immunity.
Right. We talk about, the way we put it is co-infections, right? So in other words, we know about comorbidities, right? Diabetes, obesity, blood pressure, especially in today's virus, but people forget about co-infection. An elderly person who's sickly will have infections in their gums. They'll have parasites in their intestines. They'll have toenail fungus. I mean, there'll be a million things, unfortunately, going on in this person's body from an infection and health standpoint. And then you throw in a challenging virus and you wonder why you have, a problem. It's pretty obvious. The immune system is just keeping it alive. And like, as we know, you and I love the hygiene hypothesis. If you don't have enough challenges, like you live in a sterile bubble, which is kind of what's being created today in the world. Everyone's house is a sterilized bubble.
Yeah.
Your immune system isn't challenged enough, and it's, once again, you get weak. I always make the analogy: if you don't think hard, you start to get dumb. If you don't lift weights or challenge the frame against gravity in some way, like get off the couch and walk, you get weak. So how could an immune system that's designed to be, running around in a forest eating dirt off the apples and God knows what other stuff, how could that immune system that's designed to be challenged to some degree, how is it supposed to stay strong if you're under a spray bottle and being wipied, and you're basically creating an artificial environment that is detrimental to your health. And like what you said earlier about putting gluten in a pan and letting it, in a sense, rot. I mean, that's obviously the wrong word, but ferment or break down or degrade, proliferating organisms on purpose and then ingesting those on purpose. Think how, and how beneficial that is. But imagine, if you live in a house or a building where you have a million ways of stopping every germ known to man, every bacteria and virus, your immune system's going to get lazy.
Right. So there's a way to prepare, there's a way to do fermented foods, and there's a way to do culturing of foods. So we want to create the right medium. So, maybe instead of just putting water and a flour product together, and you're worried about the bad organisms that can happen there, You just put a little apple cider vinegar and you let it ferment that way. And that prevents any bad organisms or any bad mold. And then you would have the good probiotics or the good organisms you want. So again, it's all conditions again. So we kind of, again, started the conversation with germ theory versus environment. So it is both. And so the pleomorphism we mentioned earlier, where you can change an organism from good to bad, is based on the environment. That's true of our person. You can look at us as an organism and what we put ourselves in, summer, winter. You do the same thing with a red blood cell. You put it in a pH alkaline or acidic, and it'll turn from bad to good. So if we look at things that way, pay attention to ourselves that way, things won't be as complex as we think it is. You know, we think, oh my God, how can I prevent illness? What if I get a disease? Well, pay attention to what keeps you healthy, not trying to prevent the sickness. Well, what are the good things I could put in place to have a more vibrant body, to feel more energetic, to feel stronger? Then you avoid sickness. You don't want to study disease. You really want to study what keeps people healthy.
Yeah.
That's the whole premise.
It gets confusing because we have a system called the healthcare system, and it's really a disease care system with small caveats. I understand. I'm not going to say that, you know, it's a complete disease care system, but it's mainly a disease care system. If it was a healthcare system, we would go to the doctor with no symptoms, and he would give us a speech a mile long about all the stuff we're doing wrong. Yep. Even though our blood work came back perfect and we look like the picture of health, he's going to say, you know, you're not doing your prayer meditation. You're not doing your exercise enough. Your resting pulse is 45. It used to be 43. What's that about? Right. And it would be a constant push for optimum health instead of, well, it seems like you're doing as well as your parents, so good for you. You know, I mean, this idea that, you know, if you're living up to the genetic potential of parents who you may or may not express the genes of, yeah, you might be doing pretty darn well for yourself, which is, you know, hideous. But, you know, you see stuff like that, and I'm blown away by, you know, what I hear sometimes. But
yeah, and an easy example, one that I always use is, you have an arthritic patient, they come in, their joints hurt, let's say it's their knees. So what are they offered? They're offered the drugs, they're offered anti-inflammatories, they're offered the painkillers. So what have you done? You let's see, you have bone on bone. You're grinding that up and you feel the pain. They're just going to take the pain away. So you're going to continue walking on it, grinding it and damaging it further. You're not addressing why the cartilage is missing and rebuilding the cartilage, or improving circulation at the joint, or maybe there's calcium deposits there. You're not doing any of that. You're just taking away the pain, reducing the swelling, and you're continuing to damage the joint until you go for a knee replacement. Right. So those are ways of addressing symptoms, but not, again, the underlying cause. So if you address the underlying cause, now you're dealing with things. I mean, we actually have today things like stem cells. Now, stem cells become controversial because they think they take it from babies and that you're harming babies. But the reality is, stem cells come from umbilical cords. Those umbilical cords are thrown out after the birth. So you can save those and you can inject those into your knee. And where you'd have bone on bone with an x-ray, you'll actually see the cartilage there. It actually regrows, and you can actually avoid surgeries, but the surgeries make more money. So you work with the drugs, you go to surgery, and it's a big profit core or center for the medical system. But if you really want to do things the right way, it could all be prevented, and you can actually improve the body. So now if you think about losing cartilage there, where else are you losing cartilage? What else is degrading in the body? You can improve your bone density with simple bioidentical hormones and simple remedies that are over the counter that you can do at home.
Alkalizing the body.
Yeah, but again, it's thinking outside the box, right? So you're not going to do anything unless you get outside that medical box and what we're dealing with.
Well, Michael, thanks again for coming on the show. You know, that was a load of great information. We're going to summarize this, you know, in a PDF after this and put it together for everybody. Anything else you want to add? Because, you know, that I think that really, you make some great points. And anything else that comes to mind?
No, I hope I addressed everything that you wanted me to. I appreciate you having me on your show. It's awesome. It's always a pleasure to talk to you and have these conversations. So yeah, I mean, anything that I could do. I guess I would just highlight the fact that, you know, in the summertime, people ground. They're outside, bare feet, hiking, beaches. Try to mimic the outdoors in the summer, indoors, and don't forget to humidify. And I'm sure you'll have that all summarized for your audience. But
Yeah, when you talk about grounding, I want to make sure is reminded that you can buy grounding kits. But you and I talked about this before on the last podcast, but you can buy grounding kits that plug into the outlet, your electric outlet, the little round centerpiece. Be careful, put it in the right spot. You can look it up. That will ground your body. You can stand on this little mesh blankets and wrist guards that take the electrostatic charge out of your body as if you're standing on real ground outside, which is hard to do when it's freezing out.
right.
So yeah, that is part of the mimic of summer indoors.
Yeah.
In the winter.
And improve circulation during the wintertime and the whole 9 yards.
That could be the name of a book you write, right?
I'm sorry?
Mimicking the summer indoors. That's the name of your next book.
Maybe we'll have to write one.
That's an attractive
I'll
title,
have
right?
you it or co-author it or something.
Mimic the summer indoors. I like that title. In the winter, all right? Anyway, Uncle, thanks again for coming on. I want to have you on again because I really enjoy every time we talk. I learn something, and hopefully you do too from me. And
absolutely,
our clients can grow from this, and they can share this with people, and everybody just grows into health instead of harboring around and playing with disease.
Definitely.
That's what I want from people.
Thanks,
all right, Mike. Have a great day.
Absolutely.
Nice
you too.